Indonesia is an archipelago located in Southeast Asia. It is known for its grand mountains, lush rainforests, and sunny beaches. Sadly, this is the Indonesia most people don't know. The Millennium Development Goal, MDG, has come up with ways to help solve some of the most severe problems in Indonesia. This is eradicating poverty and hunger. The first MDG goal is to eradicate extreme hunger and poverty by halving the percent of people who suffer from this problem. With economic growth, the government has developed better food security, agricultural development, provision of revolving loans, and investment in solid job creation among the cities. The World Bank has been a big supporter of poverty reduction as they help the Indonesian government encourage poverty trends, social assistance, social insurance, community-based programs, and also aid in generating better jobs, while donating technical support towards implementation of government programs. Even though Indonesia has successfully achieved the goal of halving the poverty and hunger percentage from 1990 to present day, challenges such as regional disparities, non-monetary poverty, and rapidly rising inequality remain. The biggest problem, though, is that the people who have come out of the poverty state only remain just above the poverty line, so the chances of them falling under the poverty line next year are really high. In order to escape poverty, people must be available to a decent job that provides them enough income to support their families, especially to buy food in order to avoid hunger. 72% of Indonesians live in housing that is overcrowded, poorly structured, does not have clean running water, or good sanitation, or electricity. 37% of Indonesians under the age of 5 are malnourished and shorter than they should be. This is achieve universal primary education in Indonesia. The second MDG goal is to achieve universal primary education in Indonesia, and has been successful. There are great chances for Indonesia to achieve the goal, although the main issue that MDG faces is the quality of the education. Indonesia has begun investing in primary education in the mid-1970s using windfall from oil exports to construct one primary school in each of the 60-odd thousand villages across the country. In 1988, all except for 0.4% of school-aged children were enrolled in primary school or had completed it. The investment toward education continues to increase as about 1/5 of Indonesia's total public spending is put toward education. The World Bank has placed education at the forefront of its poverty-fighting mission and is one of the largest external financiers of education in the developing world, which includes Indonesia. Some problems they face are the question, do we spend resources to reach the few children that have no access for education, or invest the money for resources in secondary and tertiary education? Because the poverty rate is so bad, it continues to be an education attainment. A national household survey in 2009 showed that 6 out of 10 children dropped out of secondary school because of financial constraints, and that's due to poverty. The main issue is the quality of the education that they're receiving, and because it has remained low over the past 50 years, this is seen as children from lesser fortunate backgrounds receive inferior quality education. Also, universal education has been nearly achieved at primary school level. Secondary school participation also continues to trend upward. But if Indonesia wants to improve its global competitiveness and sustain quality economic growth, they must address their issues clearly and smartly.
Indonesia has done a lot towards gender equality in their country. They have removed all parts of the legal system that discriminate based on gender and have a mandatory portion of parliament that must be female. This is in part thanks to international pressure on the country to change these laws through trade incentives via the UN. However, they have not combated gender inequality on a local, municipal level, and it continues to thrive just out of sight. This will likely continue unless further action is taken on a local level. In cities, gender equality is prevalent. Women hold positions of power, and girls receive equal education to boys. In fact, at any given moment, it is law for 30% of the Indonesian parliament to be comprised of women, significantly more than most other nations. In rural areas, though, religious fundamentalism is still commonplace. Girls receive typically less education than boys, and fundamentalist groups push for religious laws that enforce gender roles. This is unacceptable and needs to be amended for MDG 3 to be met.
Goal 4. The Millennium Development Goal to reduce child mortality in Indonesia is to reduce by 2/3 between 1990 and 2005 the under 5 mortality rate. The status of child health care in Indonesia has improved very significantly. In the 1900s, nearly 10 out of 100 children died before their 5th birthday. By 2012, this number fell to 1 out of 100 children. Despite the huge success in reducing child mortality in Indonesia, this progress is not apparent throughout the slums of Indonesia. The 2012 demographic and health survey revealed the large deficits in rates among the poorest 20% of households, which is 70 under 5 deaths per 1,000 live births, and the wealthiest 20% household, which is 23 under 5 child deaths per 1,000 births. However, the overall progress in reducing child mortality is still one of great achievement. Reducing the child mortality rate has been implemented through improving the coverage of immunizations. The coverage for measles vaccinations in 1-year-old children has increased from 45% in 1991 to 80% in 2012. In addition to this, there has been an increase in healthcare providers that see children with ammonia and diarrhea. And lastly, 2/3 of children with diarrhea are now given oral rehydration solutions, increased fluids, and continued feeding. Goal 5. The Millennium Development Goal to improve maternal health is to reduce by 3/4 between 1990 and 2015 the maternal mortality rate and to achieve by 2015 universal access to reproductive health. The maternal mortality rate is one of the Millennium Goals that require a lot of hard work in order to reach the target of 102 per 100,000 live births by 2015. Although there has been an increase in halving the maternal deaths in Indonesia by there being a drop since 1990 from 390 maternal deaths per 100,000 live births to 190 per 100,000 in 2015, Indonesia still remains above the 2015 target of 110 maternal deaths per 100,000 live births. The lower level of success in achieving maternal mortality targets is due to the complex nature of delivering services to pregnant women and others. To handle obstacles faced by mothers in labor, among other things in Indonesia, 3 key programs have been implemented. 1. The government financing for maternal and neonatal health. Child Parasol is an insurance fund that provides funding for mothers and their infants. It seeks to reduce financial costs for expecting mothers by providing labor insurance, which includes pregnancy exams, childbirth services, as well as family planning and care for newborn babies. This insurance plan covers the whole of Indonesia, which is one of the major perks of the program. The activities and management of the Japarzel insurance plan is carried out together by the government, provincial government, and city district government, which does not make it a one-man's job. Secondly, the mother class was implemented. The mother class is a class developed to increase the knowledge as well as change the behaviors of mothers and families. The purpose of this class is to increase knowledge, change the attitude and behaviors of mothers so that they can understand more about pregnancy, prenatal care, delivery, child care, post-delivery family planning, newborn care, and other local myths, beliefs, and customs, as well as how to prevent infectious diseases and how to obtain a birth certificate. Thirdly, the maternity waiting home as well as the family planning program was implemented. And what it is a home or building that is intended to provide quick access to health services for expecting mothers before delivery. In some parts of Indonesia, such as disadvantaged areas, borders, and islands, getting to the nearest hospital is an issue due to infrastructure and transportation limitations, geographic conditions, and difficult weather, as well as the lack of health workers, which is very dangerous when mothers are experiencing labor complications, which is why there needs to be a place or a referral building which expecting mothers can live temporarily before going into labor, and that's what this building is. Goal 6. Combat HIV, AIDS, malaria, and other diseases. The Millennium Development Goal to combat HIV, AIDS, malaria, and other diseases is to have halted by 2015 and begin to reverse the spread of HIV, AIDS, and achieve by 2010 universal access to treatment for HIV, AIDS for all those who need it. The spread of HIV and AIDS is one that was of great concern in Indonesia, as there is an evident difference in the spread of the disease amongst different areas. The highest percentage of AIDS cases in Indonesia is in the age group of 20 to 29. In order to address the rate of HIV and AIDS as well as ways to prevent it, efforts have been made to bring forth its awareness. 1. To increase the knowledge amongst teenagers, the HIV and AIDS campaign, I know and I'm proud of it, has been implemented in schools around Indonesia, as well as the ABAT campaign, which is an educational campaign on sexual practices, which was implemented in 10 provinces. 2. The number of healthcare services for counseling and testing has increased from 156 in 2009 to 500 services in 2011. Hospitals providing care, support, and treatment has also increased from 163 to 303, which consists of 235 main hospitals and 68 satellite hospitals. In efforts to treat the population infected with advanced stages of HIV, antiviral treatments have been implemented throughout Indonesia through government management and programs. In 2009, the percentage of the population infected with advanced stages of HIV that is treated with antiviral therapy amounted to 76.5% and increased to 84.1% in 2011. The 6B Millennium Development Goal to combat malaria is to control the spread and begin to reduce the number of new malaria cases and other major diseases by 2015. The efforts to reduce the number of malaria cases has had great results. There has been a decline from 1990 to 2011 from 4.68 for every 1,000 people who were at risk, which then dropped to 1.75 for every 1,000 people of the population. Cases of malaria are strongly linked to environmental changes, a high mobility of the population, climate changes that lead to a longer rainy season compared to a dry season, prolonged economic conditions in certain areas where certain groups of the population become nutritionally deficient, causing them to be more susceptible to malaria, treatments that are ineffective, and declining concern and public awareness of integrated malaria prevention efforts. Therefore, in order to prevent and create awareness of the Malaria Center was created by the Provincial Health Office. The Malaria Center carries out the duties and responsibilities of the regional administration in order to establish a society free of malaria transmission. Within the program, there are 2 malaria combating personnel who are trained from every village to learn about malaria, conduct meetings for preparation of the community action plan to combat malaria, and forming a village malaria committee, which will help village communities receive education on malaria, which would further help it to be able to eradicate malaria that is community-based, as well as improving the quality of living their lives to live healthier. In addition to this, the local government will also provide support through the Malaria Villages Allocation Fund.
Very little progress has been made in reducing Indonesia's environmental impact. In fact, in the last 5 years, their greenhouse gas emissions have increased. Successful efforts have been made to protect marine biodiversity, but as their only success. Sustainable water goals and slum reduction have also not been met. There has been little efforts to amend this situation on any level. This downward trend will continue without drastic action on the part of the government. Indonesia is the world's third largest emitter of greenhouse gases. They also have the highest rate of deforestation on the planet, cutting down 840,000 hectares of trees every year. Furthermore, only half of the population has access to safe drinking water and basic sanitation, and the slums which were supposed to be improved are expanding with the booming population. Marine biodiversity, on the other hand, is being protected in an interesting way by considering seaweed not waste but a valuable product, thus reducing the need for mass fishing. More initiatives like this need to take hold in order for Indonesia to come close to meeting MDG 7. As a nation, Indonesia is meeting MDG 8 with great success. Their economy is one of the fastest growing in the world, and international trade makes up a significant portion of their GDP. Indonesia is considered a leader among middle-income nations. This is thanks to the local efforts to increase exports, as well as increased international trade. Indonesia is expected to continue to develop their economy at a steady rate without any more significant action. Indonesia earns 8 times as much money from imports and exports as they did 25 years ago. Additionally, nearly 10 times as many Indonesians have cell phones as in 2004, leading to more international connections, aiding trade. They have achieved this by devoting a significant portion of their GDP to developing their exports. This has resulted in them cutting their international debt by a factor of 4. Internationally, Indonesia is succeeding as much as could possibly be expected, meaning that MDG 8 has been met. What Indonesia really needs is sustainable growth. They've made excellent gains in several areas and very few gains in others, but many of these gains are patch fixes that will not last. Firstly, they need to slow down deforestation and the use of environmental resources before they cause more irreparable harm and run out of resources, and start developing renewable resources such as hydroelectricity and solar power. They also need stable economic growth within the country, as they've had plenty of growth on a global level already. In particular, rural areas need development for many of these goals, as they are far behind the rest of the country. Indonesia has made considerable progress in the Millennium Development Goals, but there is still more work to do.